patients are being moved from the General Del Rey Hospital, in Lichtenburg. That's in the northwest due to flooding at the institution. This is in fact the third hospital to be flooded, we're told, in just a week. Similar incidents have been reported in Lehurutshe and Moses Kotane hospitals, although the department says in these instances only certain parts of the buildings were affected. Meanwhile, at Sun City Resort, some cars belonging to guests have been damaged when trees fell on them. SABC News reporter Tebogo Phakedi is watching developments and joins us now live. Tebogo, help us place exactly where you are as we take stock of the damage being caused by heavy rains in the province.
Good morning, Ayanda, and of course, good morning to the viewers. We are at General Del Rey Hospital in Lichtenburg. This is the only hospital, Ayanda, that is servicing the Lichtenburg area. You would remember that in 2022, Tusong Hospital, which really was not working for many years, was decommissioned, therefore making this the only hospital in this area. We understand that due to the heavy downpours, patients have been moved, as my colleague Tumelos Tlhabetsi can just pan to show you. For the ambulances that are leaving the hospital, sending some of the health workers as well as the patients to some of the hospitals. We are told that others have been transferred to the Zirast area, that is 80 kilometers from where we are. Others are in Mahikeng, Mahikeng Provincial Hospital, that is in the Mahikeng area, while others have been sent to Helexpan. But of course, we will talk to some of the patients, or one of the patients who really came to this hospital to inquire, to try get health services from this hospital, but was not able to due to the flooding that is happening inside the hospital. At this point, we have not been able to get the permission to get inside, but we will in the next few minutes, given that the MEC is making his way to this hospital. I just want to talk to Sheila Dindra. Thank you so much for nakwa.
Okay, fitlhetse go na le metsi, ga gona le ditirelo, ga gona go tsena sala re tla ka bo 8, ga gona le ditirelo tse di tshwarelwang, metsi a tletse mo teng ga di auto tse tsotlhe mo teng. Ba re eme pele ga re tsore go fitlhela MC itla, mara re kgona go kry thuso ya gore re kry thuso mo re kry teng, mara no yana gona tiro e diregang.
Ha ba le tlhalosetsa go ga jana ha le batla thuso e rileng ya pholo le ye go kae?
Ba re tlhaloseditse yana ke ba re go ha ke tse ke go administration or ke kry thuso teng go ba re kgona go re thusa ba re fe dipilisi and then gona re kgona go tswa.
Thank you so much for your time. That is Sheila Dindra, one of the patients coming to this General Del Rey Hospital requesting health services. She is saying that when they arrived, what they found is flooded hospital wards, all of them. Hence, each and every person who was inside this hospital has been transferred. I just want to talk to the Department of Health, who will spokesperson, that is Sovatso Mutibedi. Thank you so much for your time. We find ourselves not in this situation, but of course this is not the first hospital. We know one in Ziras, the other in the Rustenburg area. In this instance, if you can just measure the impact for us before we get in.
Well, the impact is quite huge here. We have been at work since the wee hours. We have been trying to cushion the brand because as is the drainage system of this town is not working. So what we have done is to ensure that we take all the patients that were admitted and we take them to the nearest hospital. One, we took them to the Mahikeng Provincial Hospital, and the others we took them to Helexpan Hospital. But what we have done, the people that we are seeing outside here who are now seeking the services that we are rendering here, we've got a town clinic which we have dispatched our team of doctors and nurses where they'll then get our services. But as is, the situation remains very bad. The MEC and management are here to ensure that we deal with this matter. But the system here, it's a multifaceted problem that we're experiencing. We know this water has been experiencing this problem for some time. The drainage system is not working, but the problem has been exacerbated by the fact that as it floods, the debris would then overwhelm our drainage system here in the hospital. That's why we see the watershed that we're experiencing here.
And I understand it's the similar, is the drainage system also in other areas. The Moses Kotane, for an example, when we inquired yesterday, that was the same reason that was provided to us. Does that mean the drainage system in some of our hospitals is not able to withhold as far as the disruptive rains are concerned?
Well, we must understand that it's in the purview, it's the sole responsibility of the municipality. We rely on municipalities because as is, we have the system that we have our team of maintenance that are maintaining it. But the problem is the municipalities who are not necessarily able to deal with the system because as you see, the water is flowing down from the town here to the hospital. So what we have done as a measure, although it's just a short-term measure, to ensure that we deal with the situation here, we have creating nets where we can now direct water elsewhere instead of coming to the hospital. That's what we have done. But in Moses Kotane, the same thing was done to ensure that we deal with the problem as it persists. But we need to sit down with, as a multifaceted approach, we need to sit down with the municipality and powers that be, that we deal with this problem holistically because as is, it remains a problem. There's the third hospital in the last week or so. So we have to find a way. But as is, we will see that all the people that are here, we are servicing them, we're giving them primary health care services as we are ought to.
Yeah, I know in Moses Kotane, the ward that was affected was the maternity ward. The same here, including other 3 wards. Just to ask if your patients, all of them, the mothers that were expected to give birth, were able to be transferred well on time to other hospitals?
Well, here we had 33 patients. 3 of them were at labor. This is our ward. We have managed to redirect them to the Mahikeng Provincial Hospital. They are safe. The others, we took them to Lichtenburg Hospital. We can confirm that they are safe and they are getting the services that they ought to get in our healthcare services. But the problem as is, here we are closing. We are closing until we find a solution. We hope that before the end of the day, we will sit down with the municipality and other departments that are responsible to find a way. But the department remains resolute on our course to render the services. We will be utilizing other hospitals. We've got Lehurutshe, Zirast Complex, we've got JST Hospital, and other hospitals that are able to carry out all the numbers that we see. The influx that we see in this area will be addressed and speedily so.
Thank you so much. That is Tebogo Phakedi, the spokesperson of the Department of Health here in the Northwest, confirming that this hospital will be closed as they transfer some of the patients to different hospitals across Mahikeng area, if one can say, or the Northwest, the district, Ngaka district municipality. The MEC is expected to come to this hospital. We'll also get inside to measure the impact